right now, just as a heads up, but we can go ahead and get started. The first portion of our event today will be a quick presentation from our admissions office. So from Carrie, Jesse, and I, we have just a few reminders for you all. Are you all able to see that? Wonderful, great. Okay. So again, folks, welcome. For maybe some folks that are coming in a little bit late, we are here in attendance for our College of Nursing Admitted Student Meet and Greet event. Again, congratulations on your acceptance and admission to Seattle University. We're going to be, again, covering some quick information on the admission side of things. Just a few reminders that you all will want to keep in mind while navigating, your decision in deciding to enroll here at Seattle University. So all right, the first thing our admissions presentation will cover is a quick welcome, some admissions information, like I mentioned, College of Nursing information. So we'll get into a little bit more of the nitty-gritty into both the programs, the BSN and the Diagnostic Ultrasound program. We will then transition into some breakout rooms for the student experience. We do have some current students in both programs. Today, we'll then transition back into a larger group for a Q&A session, and then we'll close out with a few reminders for you all. So a quick program. Hopefully this is helpful to you all. Again, if you all have any questions during any of this, please feel free to drop it in the chat. Okay, a few reminders, folks, from our transfer admissions team. Just a reminder that our confirmation deadline will be May 1st. So please keep that date readily available in your minds and at the top of your head. This is going to be very important for folks as we do require students to make their decisions by this particular date. You will be able to confirm this decision, confirm your enrollment through our admissions response form that will be available in your Red Hawk admissions portal. So you'll use that email you used to apply to log back into your portal where you viewed your decision. And if you are deciding to enroll and accept your admissions decision, you will be able to do so through this admissions response form. There is a deposit that will be required. It is a $200 deposit. And this is a deposit that will go directly to your tuition once you are at Seattle University. So again, it's just a deposit to essentially hold your space. But when you come to Seattle University, those $200 will be applied to your tuition. So again, just a reminder as well to view your credit evaluation. I have been receiving quite a bit of emails on questions and maybe some concerns about credit evaluations. So please make sure that you're taking a look at that. There's great questions that are being asked. So please make sure that you're looking at that very thoroughly. And then viewing your financial aid award as well. So we know there have been some issues with the FAFSA this year, but we are trying to expedite those financial aid packages as we get them and as they get to us. So please continue to check your portal, continue to check your My Seattle U to see if that is available. You will be able to view that financial aid package before you have to make your decision. So again, making sure that you're checking all of these different things, all of these different factors to make an informed decision that is best for you, right? All right, the next thing is once you confirm your enrollment, so once you're at that next step and you have confirmed your enrollment, there will be a handful of checklist items that will be appearing. I believe these checklist items won't populate until a little bit later. So I believe the date is going to be somewhere around the first week of May. Some of these items will be some orientation types of checklist items. They're going to be maybe some housing application types of things, etc. So just keep in mind that there's going to be some checklist items populating for students who have enrolled sometime the first week of May. So it is important to keep an eye on that portal. Information about academic advising and registration as well will be available around that same time frame as well. So you'll get a timeline on when that will be taking place. Again, it likely you'll receive this timeline in May, and that registration and advising period likely won't happen until a little bit later in the summer. So just a heads up, we do want to keep you in the loop, which is why these timelines go out. So and then a final reminder about final transcripts. We will need official transcripts all due by this July 1st deadline. So again, it is really, really important that you all are double checking that you all have submitted all your official transcripts so we're able to award credit, or that credit evaluation is able to reflect maybe any spring or winter quarter classes that you all took, so that credit evaluation is up to date. But it is also important to submit your official transcripts, because once you're a student at Seattle University, and if we don't have official transcripts, students can get a hold down the line. So it is super important that you all are keeping track of your transcripts. If you have questions or are confused about whether you submitted an official transcript or not, feel free to email us. We're happy to check for you to make sure that you're ready to go. The next thing is a deadline of September 1st for students who will have summer courses in progress. So if you were planning to take summer courses this summer of 2024, the deadline to submit official transcripts will be September 1st. It is imperative we have these transcripts by this deadline, as again, we want to make sure that your credit evaluation reflects these credits, that we have official transcripts so you don't get a hold down the line. So there's a few important dates on this to keep in mind. I will pass it off to Carrie now.
Thank you, Jennifer. All right, so as a reminder, all prerequisites that you have currently in progress, they need to be completed by the end of spring term with a grade of 2.0 or higher. So some of you may have had prerequisites in progress during the winter, and maybe now you're done. So you're welcome to send your transcript now if you would like, but it is due by July 1st. And then many of you may also have prerequisites in progress during the spring. So again, we need the final transcript by July 1st to verify that you completed all outstanding prerequisites with a 2.0 or higher. And again, you can check your credit evaluation for more information. Now, we will be sending an email out to all admitted students that indicates what specific prerequisites you told us you were going to take in your prerequisite form, as well as what we identified to be your outstanding university core requirements. So that email will be coming soon, probably next week. Seattle U is about to go into a long weekend, so we will be closed on Friday and Monday. Just know that if you're trying to get in touch with us. But we do plan to send an email as soon as we can that just outlines the credits that you need to complete. And again, like through that July 1st transcript submission, Jennifer mentioned that the official transcripts are really important because it prevents holds in the future. You definitely don't want that, but it also helps ensure that you're getting the right credit. So for instance, if you're earning a DTA at your school, we need the official transcript with that conferred on it so that we can apply the right credit. So it's just very important that we get those final documents. Okay, so the art class, we're going to talk a little bit more about the university core classes that you need to complete. We'll talk about all of them on the next slide, but we give a special shout out to the art just because it tends to be the one we get the most questions on. But essentially, if you're going to have more than 75 transfer credits, which everybody should, in order to be in the BSN program, a course in those categories would count. So art appreciation, art history, music appreciation, drama history. But the safest bet is to take a hands-on art course. So a course where you're actually like making or producing the art. So you're painting the picture, you're sculpting, you're taking the photos, that kind of thing. and it needs to be at least 4 quarter credits. So if you've already looked at your credit evaluation, you'll be able to look for University Core Module 1, and you'll be able to see what's outstanding. Keep in mind that the UCore 1200, and I believe Rhonda would know it, I think it's 1800, the natural sciences ones, those are the ones that are automatically taken care of through your BSN prerequisites. So the ones you need to watch out for are 1300, and then the others that we'll talk about on the next slide. So while it's important that all of your prerequisites be done by spring, you can use the summer to do any of the remaining UCore. That is okay. And then in those cases, that's where you would need to send us your final transcript by September 1st. Just to clarify, if you're in a situation where you're getting all your prerequisites done in spring, and then you're doing some UCore in the summer, we actually do require 2 transcript submissions. So we can't wait all the way until September 1st to check on your prerequisites. We need that by July 1st. And then we just need the final transcript by September 1st that shows the UCore. So I will pass it off to Jessie.
Okay, wrapping it up. As Carrie was mentioning about UCore 1300 is the art requirement, but we have a couple of different requirements that we just want to make sure students are aware of, making sure that they're completing. Some of the titles, I get a lot that students are just confused about what the UCores are, so we'll kind of break that down. UCore 1100 is our academic writing seminar. Essentially, this is an English composition course. If a lot of you are coming from Washington State community colleges, that's going to be English 101, plain and simple. UCore 1300, again, is that art course. As Carrie was mentioning, this needs to be hands-on, and this just gives some overview of what the specific what the specific requirements are, and things like that. 1400 is similar to 1300. It's inquiry in seminar in the humanities. So this art courses can satisfy this if they're not like a hands-on, but more so like the study of like music or something like that. So again, this kind of outlines different things that can be acceptable: English literature, history courses, philosophy, theology, things like that. So again, when you're looking in your credit evaluation, or if you're looking in our TES tool, just making sure that you're finding courses that satisfy that UCore 1400. And then the last one is going to be UCore 1600, which is our inquiry seminary in the social sciences. So really the types of courses that can satisfy these are things in like anthropology, anything kind of in the criminal justice, economics, geography, government, political science, and then psychology and sociology satisfy these as well. Again, if you're not really sure if a course that you've taken satisfies this, maybe something is super specific and it's not something that we outlined specifically on this slide, always recommend just reaching out to your specific admissions counselor, and we can help with any confusion in terms of what UCores you have or have not satisfied. And one of the last requirements we want to make sure that folks are ensuring that they complete is that 90 credit amount. 90 credits essentially puts you at a junior level standing, which is required since this is a 2-year cohort structured program. If you're someone that is earning a DTA, 90 transferable credits is guaranteed. So that's amazing. If you're someone that has not received a DTA, just making sure that in your credit evaluation, you are looking at 90 credits. Obviously, if you're someone that has courses in progress or planned for winter or spring, those credits wouldn't have made it to your evaluation just yet, which is why it's important to send us your updated transcripts with your winter or spring grades as soon as possible, just so we can get those credit evaluations updated, and just making sure you're at exactly that 90 credits. If you're off by even a few credits, you're technically not a junior and we need you at that junior level standing. So just continue again to check that credit evaluation, and if you have questions, just reach out. And then last slide, we just wanted to shout out one of our events that we have in, gosh, almost a month away. It's our Transfer Admitted Student Day. This is just a really fun event for students that have been admitted, that have confirmed that they are going to attend Seattle University. It's a great way to meet other admitted students, as well as just all of the advisors and deans will be there. So all of our College of Nursing staff that are in this Zoom meeting right now, you'll actually get to meet them up close in person. And it's a great way to also just meet face face-to-face with a lot of other people in your cohort. So if you scan that QR code, it'll take you straight to a form where you can start registering for that event. And if you've already registered, you're ahead of the game. So yes, that is essentially it for our admissions presentation. And I think we'll move forward to our College of Nursing presentation.
Thanks, Jesse. Yes, we'll pass it off to our College of Nursing, and I can go ahead and share my screen and start us off. So.
Thanks, Jennifer. All right, so thanks everybody. As we kind of get the PowerPoint going, we just wanted to, again, congratulate you on being admitted into the College of Nursing for the Diagnostic Ultrasound and the BSN programs. So we're going to go through some information that's general to the College of Nursing, a little bit specific to the BSN program, and a little bit specific to the Diagnostic Ultrasound program. Okay, so within the College of Nursing, undergraduate programs that we have are the Bachelor's of Science in Nursing, or the BSN, the Bachelor's of Science in Diagnostic Ultrasound, or DIUS, and then we also have a post-baccalaureate. So for those of you who have a bachelor's degree already, you're considered a post-bac student. So you do have the option to complete a post-bac certificate in Diagnostic Ultrasound. If that is your situation, that's going to be something that you and I will talk about specifically when we get into things over the summer to talk about that as an option. All of our programs that are listed above are cohort models. So you all will start together as your cohorts in the BSN program and the Diagnostic Ultrasound program. There will be a couple of classes that you'll have together, the BSN students and the Diagnostic Ultrasound classes, but just a couple of classes. But for the most part, you'll be kind of in your program cohorts as you go through the program. We offer personalized advising. So you'll have a personal advisor that you will be assigned to. And again, because this is a transfer event, that will be me. And then you're also going to have a lot of hands-on clinical experience, and that applies to all of our programs, the BSN and the Diagnostic Ultrasound. All right, so a little bit more about the nursing specific information, and then we'll get into the Diagnostic Ultrasound information. So for our BSN programs, we offer two programs. There's a 4-year direct entry program, which is called our traditional program, where students enter and they do 4 years to earn the bachelor's degree. And then we have our 2-year transfer program, which is what you apply to and are coming in as juniors, only needing the last 2 years to complete the nursing program. We do have clinical experiences throughout the BSN program, and those are there listed. So you're going to get some clinical experiences in older adult populations, mental health facilities and populations, reproductive health facilities and units, pediatrics, medical surgical, and then our population health clinical internship is what you'll have through your senior year, where you actually get to do a little bit learning of like population health and nurses in community partnership with a lot of different populations that maybe need some additional access to resources. As you go through all of those, you're going to get about 700 clinical hours by the time you finish the program. Yeah, okay. Okay, so a little bit about our cohorts. So our average cohort size for the nursing program for transfers is about 90 to 100 students. And then our traditional, so that 4-year program, is about 120 students. Our average graduation rate is about 84%, and our NCLEX pass rate on the first attempt is at 90%. So most students do really well when they go in and take that NCLEX exam for licensure that first time. Our average class sizes, we like to keep them fairly small. So your lecture classes, there's going to be about 47 students to each instructor. And then the clinical sites and the clinical classes that you're going to have are going to be about groups of 9 students. So it'll be pretty small groups of students in those clinical groups. Our clinical sites are going to be located within a 30-mile radius or hemisphere of Seattle University. So that means you could be assigned a clinical site as far north as Everett, as far south as Tacoma, as far east as Issaquah, so over to the east side, or anywhere in between there. So there's quite a range of facilities and units that you can be assigned to that falls within that geographic region. So it's very, very stretched out in that sort of north, south, and east. We don't go west because dealing with the ferries and with the water is a little bit cumbersome. So we don't have any facilities that really go west off into the ferry and using that system. Our employment rates, we have a 92.3% employment rate once students finish with their BSN and get their NCLEX and their nursing license. And as you can tell, this is pretty recent data from our 2022 cohorts. So a little bit more about the population health internship. So again, this is a year-long internship that you're going to have in your senior year. You're going to be placed at a local community partner. So that might be a nonprofit agency, it might be a public school. It kind of depends on the group or the demographic of folks that you're interested in sort of learning about in a population health setting. So students are going to focus on learning the roles of nurses in community-based health and social service organizations. So you're going to learn about the organization you're placed with, you're going to learn about the population that they support, and then you're going to be developing relationships with those community partners and learning about the needs of those folks that they support. You're going to gain experience in settings beyond acute care environments. So again, sort of beyond the traditional healthcare settings like hospitals. So it gives you a little bit different experience on some of the other roles that nurses can play in healthcare. We also are going to be, you'll be partnering with communities to conduct assessments and then develop an intervention. So there's a project that you'll develop with the community agency that you're paired with, and then you'll do an assessment about that intervention or project. And we have faculty that will help you through that whole process. Okay, so NCLEX preparation. So the big thing for the nursing program is that NCLEX exam at the end to get your RN licensure. So our NCLEX preparation is really threaded throughout the curriculum, right? So in all of your classes, you're going to hear about NCLEX, NCLEX style questions, NCLEX prep. So it's all going to be sort of geared towards that final NCLEX exam that you'll take once you finish the program. So we also discussed this in your quarterly advising meetings. As you meet with your advisors, you're going to have an NCLEX prep course that's offered in your senior year that is specific to how to study and prepare for the NCLEX exam, how to figure out study strategies, creating a study plan, and sort of help you start thinking about preparing for that. Also in your senior year, you're going to get a UWorld subscription that's provided for 12 months that also gives you some additional support and resources for sort of doing some practicing for taking that NCLEX exam. We also have a mock NCLEX exam that you'll take in your senior synthesis class, which is one of the very last classes that you'll take in your very last quarter of the program. And there's a little sample question. It's kind of small, but there's a sample question of what an NCLEX style question would look like. And so you can kind of see that. Hopefully you can see that on there. Okay, so one of the places that you're going to spend a lot of time in the nursing program is in the clinical performance lab, or what we call the CPL. So the CPL is a state-of-the-art 20,000 square foot facility that houses the nursing simulation suites and the skills and lab areas. So I don't know if anybody has gotten a chance to do a tour, and hopefully there will be one available on the admitted student day to go see that facility. If not, you can certainly schedule a time to go and visit that facility anytime. It is a great resource that we have for students to really do those hands-on clinical experiences before you get into the clinical setting. So you're going to really get to do some hands-on practice with skills before you go into those live environments. Okay, so some other options that we have are education abroad opportunities. So specific to nursing students, we do have a nursing immersion trips. We've gone to Nicaragua, Guatemala, Belize, Bolivia, and this would happen in the summer between your junior and senior year. And again, that's something that you and I would talk about as you start planning that, if that's something that you're interested in doing. For those in the diagnostic ultrasound program or who are maybe looking for other opportunities for study abroad, there are a lot of study abroad opportunities that are available through the university in our study abroad office. So those are also things that we can connect and talk about as well. Okay, so now we're going to kind of talk a little bit more about the diagnostic ultrasound information. Marit, do you want to kind of start with some of these slides, or do you want me to keep going?
You can keep going, but I'll interfere whenever you need me to.
Perfect, sounds good. All right, so just kind of going on now and transitioning into the diagnostic ultrasound information. We have 4 programs or pathways within the Diagnostic Ultrasound Program, or the DIUS. As you'll see on the screen, that's the acronym. So we have a 4-year direct entry program. So similar to the BSN program, it's our students who come in and start with a traditional freshman year, go through the 4 years to complete the bachelor's degree. We also have the 2-year transfer program, which again, those of you who are transferring in have applied to that program, where you've completed some of those first 2 years and you're coming into the Diagnostic Ultrasound Program as a junior ready to start those program classes. We also have the post-baccalaureate 2-year degree and then the post-bac 2-year certificate. Now, the post-bac 2-year degree and the certificate are just for the folks who already have a bachelor's degree. And again, if that's your situation, that's something that you and I can sort of talk about and determine if that certificate is something that you want to pursue. But just for clarification, the post-bac 2-year degree is very similar and runs along the same timeline as the 2-year transfer program. So there's only a couple of classes that are different, but you'll follow the same timeline and you'll go through as the same cohort as a transfer cohort, whether you're doing the 2-year transfer program, the post-bac 2-year degree, or the post-bac 2-year certificate. You're all going to be the same cohort as a transfer cohort. And again, for clarification, that's something that, if anybody has questions about, we can clarify. Again, as we talked about, both programs have clinicals and hands-on clinical settings that you're going to be placed in. For the diagnostic ultrasound, you're going to have a 12-month clinical rotation, and this will be in your senior year. The clinical placements for these can be local, regional, or national. So that means some of you may have placements out of state, and that's something that we work with you as a student as you go through the program to sort of determine what clinical placements will look like and what all of that means as you get to that point. We do organize those placements for you, and they will be one-on-one. So one student to a clinical site based on that clinical site's requirements. We do offer those as full-time clinicals. So it's going to be like you're in a full-time job because you're going to be in those clinical settings during their office hours, right? So it's going to be like a 40-hour week, but it will follow the academic calendar. And again, those are some specifics that we'll talk about as we meet for advising to talk about those senior year clinicals. You have one location that you can do for one full year, or you can split that into multiple locations. And again, those are some specifics as you get closer to that time frame that we'll talk about as you get into that senior year. And we do recommend that diagnostic ultrasound students do talk to financial services early about summer tuition options. Summer tuition is not always covered by financial aid or scholarships. And the way that the program runs, and to be sure that you can get all of your classes in, there are 2 classes that you end up having to take in the summer. So that's why we want to make sure that students know to talk to financial services as early as possible to talk about summer tuition and summer tuition options. All right, so our diagnostic ultrasound cohort sizes. So for our first and second year, so that's our freshmen and sophomores, they're going to come in at a cohort size of about 20 students. And then in the third and fourth year, those sophomores and freshmen and sophomores sort of merge with the incoming juniors this fall. So those freshmen and sophomores from 2 years ago are merging in with the juniors this fall to create the junior cohort. And that means there's going to be about 30 students for the third and fourth years for that cohort size. The average graduation rate for our program is 97%, so most students do successfully complete the program. Our credentialing pass rate is 98%. And again, we say credentialing pass rate because you don't actually take a licensure exam. So you're actually going to do a credentialing exam. So again, that pass rate is at 98%. We do have the clinical sites, again, that I mentioned are local, regional, and national. And then our employment rates, again, you can see are fairly high at 86% from 2022. All right, so some of the highlights for the diagnostic ultrasound program are we are Washington's first and only Bachelor's of Science in Diagnostic Ultrasound program. We're the only program in Washington State accredited in all 3 tracks by the Commission on Accreditation of Allied Health Education Programs. So that's our accrediting agency. And we'll talk a little bit more what those 3 tracks are in just a second. Graduates are going to be prepared for national certification exams without the need to take additional clinical experiences or documentation before you can do that certification exam. You'll get everything that you need for the certification exam by the time you complete and graduate from the program. We do like to note the American Registry for Diagnostic Medical Sonography, so the ARDMS. This is a website that if you go to ardms.org, there's a site that lists certifications that are offered, registry exam prep, and a whole lot more, like any information that you want to know about diagnostic ultrasound, becoming a sonographer. They have an app that will help you prepare for the certification exams and the SPI exams. So there's a lot of information that you can find on this website. It is the go-to for the diagnostic ultrasound program. Okay, so as we mentioned, there are 3 tracks in the program. There's the general track, the cardiac track, and the vascular track. So if you are going into the general track, that's going to focus more on organs of the abdomen, obstetrics, and the pelvis. So that's going to include all the internal organs like the kidney, the liver, pancreas, spleen, thyroid. So really sort of the trunk of the body, right? The general. So you have to know a lot of different parts of the body for the general track. The cardiac track is going to focus on the heart, the arteries, the veins, all the things that are within the thorax that are related to those arteries, veins, and the heart. So just kind of think about that portion of the body. The vascular track is going to focus on the arteries and veins, but throughout the whole body. So think about if you had to go in for an ultrasound for an injury on your arm or your fingers or your feet, right? So that's going to be part of the vascular track, as well as any other arteries and veins throughout the entire body. Okay, so for the diagnostic ultrasound lab, we do offer 7 exam rooms, and we have varying equipment and styles, right? Because you're going to have to learn how to navigate all the different styles of equipment when you go into your clinical settings, because not all the clinical settings are going to have the same types of equipment. So we give you a variety of equipment that you're going to learn how to use and how to scan on patients. You're going to have the opportunity to practice patient care and how to do those ultrasound exams and really fine-tune those clinical skills so that when you go into the clinical settings, you're going to feel comfortable working with the machinery and working with patients. Okay, that's really it for the diagnostic ultrasound program. This slide just kind of shows you who the undergraduate team is for the College of Nursing. So you can see Carlene Ratcliffe. She's our senior academic advisor. Then there's Robel Kamat. She also works with our incoming freshmen and first year diagnostic ultrasound students, but also supports the program in general. Myself, Rhonda Mitchell, for the academic advisor for the transfer students. Tammy Soderberg for the nursing students. She will be doing your clinical onboarding. She's our clinical onboarding coordinator. So you'll work closely with her as you get into the clinicals, as you start those parts of the program. Grace Laguna is also an academic advisor. She predominantly works with our nursing first year and sophomore students, but we all are kind of cross-trained to work with any students that have general questions about the program. And then Maya Mosteller is our undergraduate program coordinator. So you will work with her for a lot of different forms and paperwork and additional things, but you'll also get a lot of outreach and emails from her as well. And then Marette, who is here on the program with us today, is the program director for the diagnostic ultrasound. And then our interim associate dean, Jamie Nevada, who is also with us today, is also, again, our interim associate dean. So she is filling in while we are working to get an associate dean in place for the program. And then Christina Popchoy is who the diagnostic ultrasound folks are going to work with clinical placements for the diagnostic ultrasound program. All right, so that's it for the College of Nursing presentation. So we would just like to welcome you all to the College of Nursing. And we're very excited to have that you've chosen Seattle University College of Nursing as part of your journey into healthcare for both programs. And we look forward to working with you in the future over the summer and the fall as you start your classes.
Great. Thank you so much, folks. We will go ahead and transition into our breakout room. So our diagnostic ultrasound students, again, if you have not done so already, if you all are able to change your name with a little note that says DIAS student, so we know who to move to the breakout sessions. This will be your time to ask questions to current students within either the BSN program or the diagnostic ultrasound program. So give us just a few moments to make these breakout rooms and we will take it from there. Jesse, I think there might be some student panelists that need to be moved still. I think Nathan needs to be in the dais one. Looks
Let
like Nathan.
me add him.
Great, thank you. And I think that's it, and we're good to go. Amazing. Okay, folks. Well, we are good to ask our students some questions. Let's get started with some quick introductions. I will pass it off to our BSN students who would like to introduce themselves first.
I can start.
Oh, okay. I was gonna say the same thing.
Shina.
No worries.
So my name is Harmela. I'm part of the BSN transfer cohort, graduating 25 next summer. Yeah, so nice to meet everyone.
Yes, my name is Shina. I'm a mom. I also am part of the 2024 transfer cohort from the nursing program.
Great. I will open it up to you all folks, prospective admitted students, if you all want to ask them some questions. I also have some questions that we have created to kind of get to know our current students a little bit better. But I will create some room for you all to ask any questions. Again, feel free to unmute yourself or drop your questions in the chat and we can get this conversation started. So.
Hi. I wanted to ask, would you say the classwork is more online based or is it more like in-person paper based?
I think it's more, I'm trying to think of each class because each class is different. But I think it's more online, like you do work outside of class, but this quarter just started and so OB is new and it kind of seems like this professor wants us to be working in class. So it's different. Every class is different, but mostly, yeah, you'll be doing outside work from class, like online. But that's not to say that you can't be in groups and like with your classmates while doing it.
And then to segue off of what Hermela said, yeah, so you're gonna have like a lot of time that you need to like dedicate outside of the classroom setting to study and make sure that you're understanding the content. But as far as like assignments, if that's what you're referring to, everything is pretty much like turned in online.
Thank you.
Exams are usually online. Did you say in person or online? Let me think. So pathophysiology, we had kind of a choice. Health assessment, you have to be there for exams, of course, because you have to show yourself. Pharmacology depends on the professor. Everything kind of depends, but I'll say for the most part, professors kind of are lenient. So I was able to take a lot from home. Would you agree, Shina?
Yeah, so most of my professors so far, we have had all of our exams be online. Some have been proctored through Zoom and some haven't been. The only time I've ever had like an in-person exam so far was just this past winter quarter for my Giro theory class. But yeah, I'm not sure how the other theory professor for Giro might have done it, but she had hers like in person, so we had to be there at our certain time to take the test.
Someone asked about dress code for health assessment. You have to be in your scrubs. For simulations, you'll be in scrubs. Other than that, like pathophysiology, pharmacology, older adult theory, you can be wearing your regular clothing. So that's fine. Mm,
And then someone else asked a question regarding do we get scrubs from school? Yes. So I know at the campus store they actually sell like some scrubs, but I believe they're like the older models because
mhm.
so able to like order new ones. That I forgot who sends it. I think it's Rhonda. I don't know if like she sends like the form through email to like fill it out and make sure you get your scrubs and like the whole BSN packet. But yeah, the school they do provide the scrubs for you. But I do know like a couple of other students, like including myself, I ended up buying my own pair of like pants, but the scrub tops are provided.
And then someone asked, what does your schedule look like? Each quarter is different. So we just started our OB theory. So both China and I actually, but the cohort splits during spring quarter. So mental health and OB. So we're in OB theory, OB clinical, a U core course. I'm missing something. What am I missing? There's a class missing.
Your
Clinical
research methods?
Research methods. There we go. There's four. There's But they're all organized in a specific way, so nothing's like correlating with the other, if that's what you meant with how is it scheduled.
someone asked about living on campus or not. I
Oh.
don't.
What was that? Would you recommend living on campus for the first year as a transfer? So I'm actually living on campus right now, just because the commute is a little much. I do recommend it. It makes life way easier. Everything is right next to you. And you can communicate that with Tammy, and so your clinical sites will be closer to on campus. So for OB right now, I have First Hill Swedish, which is like a 2-minute walk. And then I know someone else who's in mental health who has Harborview, which is like a 5-minute walk. So it does kind of make it easier.
Oh, and someone also asked if we're able to work during school. Yes, if you feel like you can balance that workload on your plate, I definitely recommend at least just working maybe at least 1 day a week, just to really get the feel of how nursing school is for you personally. And if you feel like you can take on more, if you need that extra help, then I can definitely recommend that, if you can do that. But I also know a few people who still have like a full-time shift, but the thing is that like they work nights. It's not really feasible to be working days since during the daytimes you will be either like in clinicals or in your simulation labs or just in class in general. But I totally think that's like a you preference. And then someone also asked how often we do have lab classes. We never really had like specific set lab classes every week until this quarter, but we haven't even gotten to that portion yet. I think we start the week of like April 15th is when we're going to start having weekly labs. But from fall quarter to winter quarter, we didn't really have any like specific labs to attend weekly besides going to like your health assessment class at the CPL. If Hermela, you wanted to like touch on that anymore?
I wonder if they meant like health assessment as well. I don't know. For labs, your first quarter with health assessment, you're there 3 times a week, and then you'll have simulations. That's only going to be once a week when you get to your spring quarter. Other than that, clinicals once a week. So it's not like overwhelming a lot to the point where it makes you that overwhelmed. About how many days a week are you on campus? They tell you to plan to be on campus at least 5 times a week, just in case. But let me think right now. Right now, spring quarter twice, but we also have simulations coming up, which we're gonna have to be in the CPL. So it kind of feels like 3, and then clinicals is gonna make it the 4th. So it kind of builds up. But your first quarter, you'll at least have 3 to 5 times on campus, especially depending on your U core, because your U core doesn't go based off your nursing classes. So there is a chance you could get 3 of your classes, like 2 health assessment, pathophysiology, UCORE on Monday, Wednesday, Friday. That's perfect. It's smooth, but that didn't work out exactly the same for everyone in the cohort. A lot of people did have to come the full 5 days.
And then, oh, sorry. Was someone asking something?
I don't think so.
Okay, I thought I heard someone talk. Another person asked if there's anything we wish we would have known coming into the program. For me, I feel like I kind of got a good gauge on like what to expect before and accepting a seat into the program. I definitely expected and knew that nursing school would be rigorous and it would take a lot of like time. But other than that, no, not necessarily.
No, I think this type of like joining the committee and like talking to Rhonda, talking to Jennifer, like really helps you out. You kind of get what it's gonna look like at the end of the day. But someone did ask about clothing. Like I don't want to skip their question. They said, do we have to come in to fitting for scrub tops? I actually ordered my scrubs online. You get like a whole online website, or you can come in in the school store, I believe you could just try them on top of your clothes, and that works.
Oh,
Yeah,
but I have
and so,
tops.
yeah,
Sorry, Rhonda. You can
go ahead.
Oh, the scrub tops are a bit like larger fitting, so I recommend sizing down if anything.
Mhm.
Yeah, and just to clarify on the scrubs, there is a lot of information that I'll be giving you all as we do our advising meeting to prepare you for registering and getting ready for classes to start in the fall quarter. So I'll be giving you the specifics, some resources for that. We're also working with the bookstore to look at additional vendors that haven't been available in the past. So some of the experiences that the folks have had with scrubs is going to be a little bit different for you all coming in this fall. So where there's some new things that we're kind of putting in place with the bookstore. So that will all be specifics that you'll get from me as we go over the summer. And I'll give you a lot more information on the scrubs and kind of how the sizing are going to work, what the requirements are, shoes and other equipment that you're going to need as well.
And I had someone asked regarding studying
Mhm.
and hours a week you spend studying outside of class. I don't really keep in track of how long I study outside of class. I just know that when I study, and I'm kind of just like focused in on that. But I would say there's certain classes that you definitely need to spend a lot more time studying for. If you like don't know already, like pharm is notoriously known in nursing school. That was probably the only class that I've had to study like morning and day. And I definitely also recommend as far as studying tips is finding like your group that you can really connect with for personal support and also support in school. Because I definitely feel like finding that group to be able to study with and also just get that communal help is really helpful, and you're able to like bounce off each other regarding like ideas or regarding content that they understand but maybe you don't.
I say what I do is I have a planner. So your professors will add Canvas classes in about 2 to 3 days before the quarter starts. And so all the information is in there. So I get my planner and I go through every class and add it for the entire quarter. So nothing is a surprise, no exams are a surprise. And then each day do to-do lists, and that will help with your organization. And so when the studying part comes in, as say you have an exam 4 weeks from now, or for OB, we have one on the 19th. Studying starts the day you start learning the material. So you just kind of add it into each day in your calendar, each day on your to-do list. I would just make sure that you add that, because then the repetition helps a lot and that will just stay in your mind. So I think that's the study tip I would recommend. What's your favorite class you've taken so far and why? I'm going to say pathophysiology, because I love my professor. I love Dr. Aparwa. She was amazing. So pathophysiology, it scared a lot of people at first, but it was amazing. It was really great. And why the professor? How about you, Shaina?
I would say the same. So far, I think Dr. Parwa is definitely like my number one right now. It was great like experience having her be like your first professor for that first quarter of your transfer nursing school program. She just really provided a lot of like motivation, especially, you know, you're just starting the program, like she gets that everyone feels really scared and a lot of people sometimes feel like they don't have that confidence, but she just instills in you that like, you know, you can do this and that she's here to help you. But also like so far, we're just starting our OB class. I'm also really starting to like Dr. Lana Murchison. Don't know if I'm pronouncing it right, but she's also a great professor. She's able to keep you entertained throughout like the whole like almost 2 hours of class. And I really like when professors can give you like little anecdotes as they're talking about different content because it really helps you make that click. And yeah.
Agreed. Did we miss anything? What would you say has been the most difficult part of school so far? I was gonna say the organization, but that's done so well because of our professors. Shaina, do you have anything?
Wait, which question were you looking at? Sorry, I got
What's
lost.
been the most difficult part of school so far?
Part. Oh my gosh. I don't know.
Yeah.
I just feel like I didn't, again, I don't think I had like expectation that it was going to be easy. I kind of just expected everything to be hard so that um, I don't feel like the sense of like under promising with myself. Um, but hardest course, if anything, is farm.
And then Shaina, I think you can answer, are you able to work during school?
Oh yeah, I think I touched on that earlier, but yeah, I would say it's definitely case by case. If you have a job that's like flexible with your hours because like every quarter your schedule does change. I feel like that is best, but also it depends if you can balance that in your schedule, you know, and see how you can even handle just the workload alone first. Because I do work outside of school. I work about like 1 or 2 days a week, but I do work at a cafe, so they're pretty lenient on like my scheduling.
And someone asked, how is the financial aid if you guys received any? So both Shaina and I are actually a part of the Alfie Scholars. Applications due April 30th, so apply. It's a $30,000 scholarship for your 2 years, but you get community. That's kind of how me and Shaina actually met. So you go into the BSN program having a community. You work on social justice issues, you work on research, you work on papers, you get to learn what it means to be a civility leader. So there's just a lot of benefits outside of the scholarship, and the community is just a really big part of that.
Hermela, do you want to answer that one regarding the residence halls? I'm not really familiar.
Where does it say? What classes have been? Oh, where is that one?
The most recent one. What are the good residence
Oh.
halls?
To study in, I'm assuming. Oh, like living. I live in the Murphys and I really like that. So I would say Murphys. Good study places, suggestions, quiet cafes, library. Library is great study space. You could also study in different types of buildings. I know some people study in the business building, some people study in the comp sci building. There's different areas you can study in.
There's also up the street URL Cafe. I think it's on Broadway. I don't know. Sometimes I don't not too good with my street names, but I know it's really close to campus that if you want to study at a cafe, that it's over there as well.
Yeah, I know a lot of people study in the cafes, but the library is also a really great place because you also have private rooms. There's just different options in the library.
And you can also save money in the library because you don't have to spend money on
what technical sites? Any tips for students that are coming from out of state and are new to the Seattle area? So I would assume that the biggest thing for you would be community, just to help you adjust to the setting. So I would say look into joining nursing clubs or any type of club. Alfie is great too. I think you can apply for Alfie. You would have to double check on the website, but just finding a community would be a great start. You and your transfer cohort do end up becoming really close though, because it's so small and you rotate a lot. So I think you'll be okay. I think talk to people that also live here. They'll show you around. So yeah, community. But other than that, I think you'll be fine.
Did we answer?
So sorry, giving you a little timer. We have about a minute left, so we're going to try to get to as many questions as we can, folks. We're going to have a little bit of time once everyone gets back to this main group as well to ask some additional questions. So please, we'll keep answering them. But I did also want to plug our Admitted Student Day. I do remember Shayna attending the event. So I think that's a great place to begin building community as well, right? You start kind of getting to know your advisor, your College of Nursing, faculty, you start getting to know who else is in the program. So I think that's a great place to kind of begin building that. Sami, I know you asked about whether folks recommend working on or off campus. I will put a plug for on-campus work, as Shayna mentioned, that on-campus work tends to be quite flexible, as a lot of the campus partners that hire students note that, these are students first, their schedule changes from quarter to quarter. So that's just a bit of a plug, but it might also be interesting for students to get off campus and explore and kind of get their mind, away from school and classes. So it's really a personal preference, but it is important to find a place that, can be flexible with your quarterly schedule that changes. So.
Any last questions?
Did we ever answer the question about how long clinicals are? Or no?
Oh, no, but real quick, someone asked how many people get the Alfie scholarship. 10 people.
Oh, and then,
The
or sorry, but you can finish your
No,
thought. It
go
was
ahead.
also
What were you?
I was told by our Alfie directors that last year when we applied, literally only maybe 12 people who applied. So automatically 10 of those 12 already got it. So we highly recommend for more people to apply for the scholarship this year because it's definitely worth it.
And then what were you saying about clinical? Sorry.
Oh yeah, someone asked how the hours are for clinicals. This quarter is going to be our first time having a 12-hour clinical for OB. I believe also has 12-hour clinicals, but last quarter for our GIRO clinical rotation, it was only 8.
Yeah, in general, your clinicals will be one 8-hour shift or one 12-hour shift. The 12-hour shift is typically a 7 a.m. to 7 p.m. And that'll just be one day a week. But there are additional times and days that will be needed throughout the quarter for clinicals. And again, that'll be something that we will talk about specifically in our advising meetings to prepare you for those upcoming classes so that you'll know what to anticipate as you start your first clinicals. So those will be things that we'll go over in depth when we meet.
Okay, folks, I think our diagnostic ultrasound folks are back in our main room. So again, opening it up for questions. We've been having a great discussion and conversation over here. We've had a lot of great questions. So please continue either throwing them in the chat or unmuting yourself, whatever is most comfortable for you all. We do have our current students here with us as well. So please ask them questions. Our undergraduate transfer team is here, as well as Rhonda, advisor, and faculty folks from College of Nursing. So please feel free to ask some questions. We have about 15 minutes or so before we go into closing remarks. And we want to make sure that you all have all the resources that you all possibly can and get all of your questions answered. So.
Could I ask a question? I just wanted to ask about how you guys found the jump from prereqs to being in the nursing program, and if there was a big jump in how rigorous the course material itself was, or if it was mostly the pace that changed, or if it was super similar, just what your experience was with that.
I'll say there's a lot more information you need to know, of course, because as you progress, there's way more information that you need to know. But difficult wise, yeah, it gets a little bit more difficult, but you know, if you use the same hard work that got you here in the first place, you'll be completely fine. It kind of smoothly transitions that, like, yeah, I feel it a little bit, but it doesn't feel so strange, especially if you're going to be well organized. Being organized will really help you and it'll really push you through. So I felt the difference, yes, like, especially this quarter is a little bit more intense, a little bit more work, but I did have also a lot of work due for prereqs during that time. So kind of feel it, kind of don't at the same time. Does that make sense? Does that help at all?
Yeah, absolutely. Thank you.
Yeah, of course.
I have a question. Okay, this is very general. Is that being admitted and being accepted? Is that like, are those the same thing? Or yeah. Yes? Okay, thank you.
Yes, that's true.
I had a question. Like your experience in the program, like how do you feel like the diversity is like especially around, like for me, I'm older. I'm just curious if there are gonna be other older people. Just curious.
I can definitely touch on that. I feel like being in a transfer program versus like the traditional program, you feel a lot more like at ease. You're definitely gonna see like all walks of life, like from young to old. And I definitely don't, I feel like you shouldn't feel like your age should like, hinder you obviously or make you feel out of place. From my experience, there's definitely a lot of like other moms and parents that I didn't realize were in the program. And honestly, like you're all in the same boat, everyone's just trying to finish school and everyone's just trying to excel and progress in their life. And yeah, everyone's definitely been friendly. I haven't had any like sort of negative experience from any student or faculty since being at SU, which is great.
Yeah, and
Yeah.
for the nursing program, there's going to be a variety of ranges from Running Start students in the transfer program that are 18, all the way up to the oldest student that I've worked with was 54 years old. So there's a wide variety of ranges for students coming into the program. And so you'll get a lot of different varieties of experiences and life experiences, but everyone always seems to come together and across those age brackets, because it's really, you're focusing on being nurses and everybody comes together around that.
I had a quick question actually. How much advance are you given when you're giving clinicals or simulations? Just because I schedule my work shifts about a month in advance.
I think about a month for us, right?
How like when do we receive our placements so that we can work with our schedules? Is that the question?
Yeah, kind of like if you know that you're going to be working certain days for clinicals, that way I can make sure I'm scheduling work shifts around that.
I think with older theory, that was way easier, but OB is kind of unpredictable because we're kind of separated from each other. I don't know about you, Shaina, but like I have about like 10 people in 12 people in my clinical group, and I don't even think we're exactly each on the exact same day. So, and that was a surprise to us till about last week. No, this week actually. And it's already the first week. So OB can be a little bit like surprising and you're gonna have to work with that. But with not mental health, with older adult, you had enough time to work around your schedule. But I do know that people did have to work around with OB to switching their work schedule. Didn't hear about that with older adults.
So I can provide a little context for the clinical placements. Just so everyone knows, we work with an organization called Clinical Placements Northwest, and they help do clinical placements for all of the nursing schools, colleges, universities in Washington State. And so you can imagine it is a bunch of nursing students that they are trying to find clinical placements for. And so we all participate in we call it the clinical consortium. And what we do is we put in our order, we say we have, let's say, I'm going to make up a number. We have 90 nursing students who need placements for mental health, and we put in our order, and the consortium negotiates on our behalf with all of the facilities that are able to take students. And what this does is it creates a sense of equity so that the larger universities don't get all the primo spots where the smaller universities get sort of whatever's left over. This way, everyone gets an equal chance at getting all of the clinical placements. And so we get our order back. And then once we get those, we randomly assign students to them and we send those out to students. When we get them back will vary. So while Hermela and Shayna may get theirs back really quickly for one, it may not be your experience. And so that's why I'm sort of chiming in here, is because it sort of depends on when we get them from the clinical consortium and how quickly we can get them out to you and how quickly we can get them staffed with nursing faculty. So there's a bunch of pieces that all have to happen. We do try and get you that information at least 2 weeks prior to the next quarter starting, but sometimes that it's really tricky. And you do need to onboard at that site as well, which involves completing modules, verifying that all of your health records are up to date. So there's quite a bit of work that goes into that. So all that to say, there's going to be some times where there probably will be some pressure where you're going to need to provide a schedule for work, and we're not going to be able to give you the data that you need. And so what I would ask you to plan ahead for is to let your work know that some of this is out of your hands and some of this is out of our hands. And it's just part of this clinical placement sort of dance that we do with our clinical consortium partners. But we do our best to get it to you as soon as possible.
Thank you. I appreciate it.
Yeah, you bet.
I wanted to ask, when is the BSN orientation going to be? And then kind of what should we expect, like we're going to be doing during the orientation?
So I'm not sure what you mean by orientation. I know there's going to be a lot of information that's going to be emailed out from the orientation team of the university to all students, transfer and those who are coming in as first time in college. As far as for this group, right? So being ready to go through like an advising orientation. It's not really an orientation, but it's really an advising session to talk about the program and the plan and the classes and what you're going to need to do, the steps to anticipate over the summer. All of that, I am currently trying to get that set up. So anticipate those sessions are going to happen right around the middle to end of May. I think registration for students is going to open, for transfer students is going to open on June 3rd. So I'm going to have a couple of sessions before June 3rd, and then I'm going to have a couple of sessions after. But they'll be right around middle of May and then in like that second week of June. But all that information will be sent out to you all through the orientation team. Now, the orientation team also has a lot of really great orientation modules and sessions that are going to be happening over the summer, that you're going to be able to create community and get to know other students, not only in these programs, but with also within other programs and across the university. So all of that information, I believe, is going to be emailed out over the next couple of weeks. And then, of course, as Jennifer and Carrie and Jesse talked about, there's the admitted student day for transfers on May 8th.
Is anyone able to speak on the 2-year on-campus housing requirement? Is that applicable to transfers for the 2-year program as well?
Yeah, I was actually just typing the response right now. So if you're a transfer student, so this does not apply to the Running Start students. Running Start students would need to live on campus. But if you're a transfer student, you would have to be a junior. So as long as you're 21 or older, then you don't need to live on campus.
And under 21, you would until you're over 21?
If you're a junior, I don't believe you need to. Yeah. So.
Okay, thank you.
One thing, a caveat to that is if you happen to see that your designation is that you are not a junior in the system still for some reason, you would just reach out to the residence halls folks and just talk with them about, this is my situation. This is the, I understand I don't necessarily have to live on campus. And then they will clarify that with you and then let you know what the process is to get that designation updated or changed. Because I do know there's sometimes where students sort of get caught in what their designation is that they're not necessarily coming in designated as a junior right away. And that can be impactful. So you'll definitely want to keep an eye on that and reach out if you have any questions.
Okay, thank you.
I had one other question that might apply to some people in here. If I already have a bachelor's, does the UCOR classes still apply to me or no? Okay.
Yeah, if you're a post-bac student, the UCOR is taken care of.
Awesome. Thank you.
Do the UCOR classes have to be done before we start in the fall?
Yes.
I just want to clarify that statement. My understanding is that if you are a post-bac student, you do have to take UCOR. You just don't have to take all of them.
Right, the module one. So you wouldn't have to fit in extra things that are required like prior to starting because the module 2, like everyone has to take. So it's part of the curriculum.
Yeah, so just to clarify the question, Thomas, are you talking about things you have to take outside of Seattle U or the classes you have to take at Seattle U?
I was thinking the ones at Seattle U, so I just didn't know if there was a difference. So I'm glad that I clarified.
There is a difference, actually. The ones at Seattle U, our post-bac students, and Rhonda, you know this verbatim. So I'm going to let you say it because I'm going to flip-flop them.
Yep. So for post-bac students, you have to take UCOR 2100 and 2920. So for the other traditional transfer juniors, they have 4 UCORs to take. And again, that's something that we'll talk about in those advising sessions about how many there are for each type of student. But if you're a post-bac student, you only have 2 UCORs that you would have to take, the 2100 and the 2920, and those do have to be taken at SU. They're a graduation requirement for us.
Thank you, Rhonda. And I wrote those in the chat because I don't know about you all, I'm a visual gal, so I also like to see it written down too.
Perfect. Thank you.
Yeah.
And then,
Becca, sorry, Becca, did you have a question that you sort of said about the same time I started talking?
Oh, I just, I got a little confused about whether or not those have to be done before we actually start in September.
So the module 2 and module 3 UCORs that are part of our program that you take while you're in the program will be classes that are part of that schedule. And there's 4 of them that you would take unless you're a post-bac student.
Okay. And that's like the 1300, 1400.
So the module 1s are ones that you have to have completed before you can start the program. Otherwise, those become extra classes. And there's no space in the program to add additional classes that are at the 1000 level. So that's why those are sort of considered to be done before you start the program in fall. But the module 2, which are the 2100, the UCOR 2500, the 2920, and the 3000 level, are the 4 that are required to be taken during the program. And that's something that I will clarify and talk with you all about in those advising sessions in May.
Okay, cool.
Yeah.
I can answer that question. Core classes will be different from those prerequisites, folks. And it is important to know that. So prerequisites are classes that are applicable to your major. We need to see completed for BSN and diagnostic ultrasound students. Prerequisites need to be completed by the end of spring term. Core classes, I'm not sure if you all remember during our admission slide, Jesse was talking about the different descriptions, UCOR 1100, UCOR 1300, UCOR 1400, etc. Those classes are typically classes, kind of general education requirements that students typically take at other institutions, right? You can satisfy these classes at other institutions that are, again, just general education. And those classes we're a little bit more flexible on. So those classes students can complete over the summer if you have not completed those already. So I encourage students to take a look at their credit evaluation and see if they're missing any 1000 level class. And if you are, it is important that you either make a plan for it. If you're a little confused about that, you can always email us as well, and we're happy to help so that you all are on track to complete those, because it is imperative that you all are completing prereqs and core classes before you begin at Seattle University, because your schedule as BSN and diagnostic ultrasound students is so packed that this can delay your graduation times. So it is important that you all keep that in mind. Okay, folks, so we are almost at time. I want to be mindful. So if you all have some additional questions, but again, we are almost at that 6 o'clock time frame, so.
I see one more question in there. This is for diagnostic ultrasound. Gurjeet, that's a function of how the credit evaluation works. So it's getting into a little bit in the weeds to describe it now. So if you have a question, just feel free to reach out to your admissions counselor, but those were recommended courses for 2024. It's just a function of the credit evaluation. So you can reach out to us by email for more information.
I will also briefly share my screen so that you all can see this core slide again. I know I mentioned maybe taking a picture of it for folks that maybe want to have these descriptions readily available. We can also send it your way, as Jamie mentioned. Maybe you all are more visual learners, want to have it very like tangibly in front of you. So feel free to email us, and we're happy to send this description your way if you all are missing any of this. But again, we were happy to help plan for these courses so that they are completed by the right deadline. So just a little heads up on that. As Jesse mentioned, if we did not get to your questions today, or if you have very nuanced questions or specific questions, you all can reach us directly. She linked to our transfer portal, so you all again can contact us through there. So.
All right, so we're coming to our final few minutes. So as Jennifer said, our contact information is in there in case you have any final questions for us. Again, May 1st is the confirmation deadline. So if you have questions approaching that date, just reach out to us and we can answer your questions. Also, like I said, just another reminder, Seattle University is closed on Friday and Monday. So if you are emailing in the next few days, just probably expect a delay until next week for us to get back to you. But just stay in touch with us for the next month. We're happy to answer your questions. We know it's a big decision, so we want to provide all the information that you can. But yeah, just reach out if you have anything. So again, huge congratulations to all of you. And thank you to everyone who joined us from the College of Nursing, both faculty, staff, and students, to spend time with you today and to share their experiences. It's always extremely useful to hear from students who are currently in the program, as well as our alumni, to learn how it went for them. So we really value your perspective, and we thank you for taking the time to join us today. It's very valuable.
Thank you.
Thank you to everyone.